Welcome to my podcast. I'm Farrah, a student at Nova Southeastern University in the Doctor Occupational Therapy program, reporting live today from Tampa, Florida, with OTD 8244, Innovations in Technology and Contemporary Occupational Therapy. In an effort to raise awareness for my future profession, it is extremely fitting to inform everyone on hand therapy during Hand Therapy Week, the first week of June. On today's episode, hand therapists use virtual reality in stroke rehab from an occupational therapy perspective. I will discuss what is an occupational therapist, what is a hand therapist, and how hand therapists use virtual reality in stroke rehab. First things first, what is an occupational therapist? Occupational therapists work with individuals of all ages with the goal to restore or enhance occupational performance or level of daily function. We do this by using a wide range of evidence-based management approaches. So, for instance, to promote independence and maximize quality of life for a client, treatment may include constraint-induced therapy with assistive technology. Our hands are strongly connected to functional independence, which is why occupational therapists seek hand therapy as a specialty. Which brings me to my next topic. What is a hand therapist? A hand therapist is either an occupational or physical therapist who may have achieved an advanced certification after passing a rigorous exam. Hand therapists focus in on upper extremity conditions like carpal tunnel syndrome, frozen shoulder, or even neurological conditions such as a stroke. Speaking of which, over 800,000 people in the United States have a stroke each year. In fact, about 2/3 of stroke survivors experience arm motor deficits from paralysis or weakness, leading to a diminished quality of life. Arm and hand function is known to be the most debilitating and hard to deal with loss. Luckily, this is where occupational therapy comes in, by incorporating novel assistive technology to improve hand function. This results in increased independence, decreased caregiver demands, and increased quality of life. Remember the evidence-based approaches I mentioned earlier? Well, in occupational therapy practice, there is strong evidence on interventions that include client-centered, meaningful goals, and constraint-induced movement therapy for stroke survivors. With that being said, 500 to 600 repetitions a day is recommended in order to relearn a skill to effectively rewire the brain. Well, unfortunately, 85% of individuals do not perform to this intensity due to pain or boredom. So how exactly is hand therapy and virtual reality used in stroke rehab? Well, virtual reality is a computer-based technology that lets clients interact with multisensory stimulated environments and receive real-time feedback on their performance. One of the latest assistive technologies is called MindMaze Pro. It was created in Switzerland, stems from over a decade of research, and has proven success in the European market since 2013. This virtual reality treatment for clients recovering from stroke is the intersection of neuroscience and entertainment. One client said, "It's just like you're playing a video game, except it's actually helping you." Not to mention all the other benefits reported. It's more enjoyable than traditional therapy, it's more personalized, it's easy to adapt, has enhanced feedback and analysis, and overall improved outcomes. MindMaze was designed to help stroke survivors begin recovery early and to continue to achieve maximum gains. It has features for the hand therapist to use training games centered on neuro rehab and cognitive paradigms to engage a client. A client can perform interactive exercises with a customized 3D avatar. And since it's easy to adapt, therapists can start constraint-induced therapy interventions both bedside and wheelchair. Plus, the portable device allows continuous therapy after leaving the hospital, to help them reach that goal of 500 to 600 repetitions a day. The bottom line is, the sooner the client begins therapy, the greater the recovery potential. Occupational therapy combined with virtual reality is an evident breakthrough to achieve the greatest recovery and quality of life. Thank you for listening to how hand therapists use virtual reality in stroke rehab from an occupational therapy perspective. Until next time, this is Farrah.